we do it here. Avoidance, denial, procrastination, staying stuck in bad relationships, not leaving toxic workplaces, not asking for help, people pleasing, putting others ahead of ourselves, overextending, overworking, poor self-care, not getting the medical attention you need, putting up with abuse, not setting boundaries, not asking a medical practitioner for guidance, learning to do it all ourselves, self-medication, and the list goes on. Gambling, pornography, video gaming too much, anything in excess. So the three of these keep your problems standing in life. And if you go to your medical doctor, you often share the physical symptoms because we want relief from that so we can keep pushing ourselves through. A lot of, as a therapist, I do CBT, cognitive behavioral therapy. I do EMDR to help you look at memories and where physiological symptoms maybe are lodged in your nervous system that keep getting triggered. Meditation is also learning to sit with symptoms instead of always looking to numb them. It's about working on your symptoms. And if I had to give us a goal in life, I have this one too. If I had to give us a goal in life, we all have life tasks of school, work, social, intimacy, self-care, spirituality. I put self-care and spirituality in the same boat because it's completely in our control and we don't do enough of it. And so spirituality is not religion. It's you enjoying your spirit, you liking your own company, liking the content that goes on in your head, liking your own company with hobbies, interests, etc. But school, work, social, intimacy, very in control. And so I often tell clients or patients, if I had a magic wand, I can take away your problems. Where would you like to be? So the goal is always to wave this magic wand, take you from where you are to where you want to be. This gap are your symptoms. Again, back to this table here. It's important for us to start looking at life about symptoms. All human symptoms have a purpose. Are you exploring in your life where your symptoms are at when you feel stressed out? Are they physical that are more bothersome? Negative thoughts that tell you you're not good enough or not capable? And this is great to use with people, but it's great to use for ourselves, even as a checkpoint, to say, okay, pause and reflect. Monica, where are you at right now? What's going on? What are your symptoms? And am I having enough time to deal with them? Am I getting the right help? Am I breaking certain patterns? As I mentioned about parents, my mom used to say, hard work doesn't kill you. But my mom's work was a very different type of work than mine. And so at one point I remember saying, hey, Monica, that narrative of hard work doesn't kill you is mom's. And that worked for her, but it doesn't work for you. Hard work can kill you. Mm-hmm. It's not about working hard. It's about working smart.